YumanLife Health.
My name is Christopher Cox. I've been living in Yuma since 1997. I've been coming to Yuma my entire life with my family. My grandfather moved here in 1941. I've been working in the profession of audiology all my life. My father's an audiologist, and I've worked with him in his shop since I was a kid. I got my master's degree in 1997, 2007, University of Florida through the Los Angeles campus. Got my doctorate degree in audiology. The day I graduated, went home, started packing up, and moved here immediately afterward and opened up this practice here at the Crescent Center. The biggest complaint that I hear among patients when they come and meet with me is their inability to connect and relate with other people. If you think about the way that we connect with people, that we communicate and talk to people, it's through our hearing. We speak, we hear, yes, we see them, but we exchange thoughts. We relate to people by what they tell us and what we tell them. Hearing loss is the third most common medical complaint that any doctor will hear. If you have normal hearing, waking up one day and not being able to hear what's going on around you, not being able to hear your children speak, it can be a very isolating, difficult experience to go through. Hearing loss is something that could strike at any age. You could be born with hearing loss, you could be born deaf, you could have normal hearing one day, the next day, for known or unknown causes, have difficulty with your hearing. I've been practicing in this industry since 1992, and the entire industry has changed. The devices that we use to fit hearing loss have changed dramatically. People could be wearing hearing aids and not be visible to anybody else. Most of the hearing aids we fit now are very difficult to spot. You don't see them. It's also become more accepted to have things in your ear thanks to Bluetooth. People could be wearing a hearing aid and everybody thinks they're just talking on the phone. Hearing aids not only are smaller than they have been, they're more functional, more comfortable, able to hear and understand more clearly. I enjoy going to work. I have friends that talk about dreading waking up and going to work, and I enjoy it. I love being at work. I like what I do. It's difficult to explain the feelings that it generates when you take somebody who generally feels and is depressed. They cannot hear, they cannot relate, cannot connect with people, and then you bring them in here and help them to hear for the first time in many, many years. Or when you're able to help a child speak to his or her mother or father, and sometimes people will just break down and cry in here. Yes, this is my profession, but I do enjoy it. The first thing I'll do is sit down and talk to you, find out exactly how hearing loss may or may not be affecting your life. Really try to look at how the hearing loss is affecting them, what's important to each individual. Some people, very, very important to them that nobody know they're wearing hearing aids. And when I know that, we'll work on that. Set it up so that people won't know. When we find out how the hearing loss is affecting you and what you're looking for, we're able to set realistic expectations, counsel, explain the limitations, explain what we can, what we can't do. Hearing test is next. We go in the sound booth and through a series of tests, we find out just how severe the problem is, or if there is a problem. Sometimes people come in and they don't actually have hearing loss, or they have wax in their ear, and we can deal with that. And I can show you, we've got a monitor where I can show people what their ear looks like from the inside out, and I think that's kind of fun. We don't just want to find out if you can hear or not hear. We want to know what level, what degree of hearing loss you have. And different people are able to hear and understand at different levels. It's pretty easy to get somebody to hear. That's just making everything louder. But the most difficult job we have is helping people to understand. Understanding and clarity is quite a bit more important than just being able to hear. There is a big difference in patient care and quality when you look at what a box store can do for you and what a professional that's dedicated to this with his own office can do. When somebody comes into this office, they get access to me. And I've been here since 1997. I'm not going anywhere. You'll also see me for your follow-up care. If you have problems, you're not going to see Jack today and Sally tomorrow and somebody another day. You have access to me. what can you do for ringing in your ears? A common treatment for that is to try to retrain your mind not to pay attention to the ringing. When you go to sleep at night, have a CD on. You can have a relaxing CD of music or nature sounds, ocean, barely loud enough to hear above the ringing in your ears. Always have something on in the background, even if you're home alone. Just listen to something that's not objectionable, something that you like. It doesn't matter what it is. You'll train your mind not to focus on the ringing, and in many cases that can go away simply from that treatment without needing the use of drugs or anything else.